Health assessment is important in nursing, and for mental health nursing, you'll need to make a mental health assessment. It's been said that mental status is the cornerstone of mental health nursing, and these are the basics from which you'll make your assessment. For a mental health assessment, start with a general description of the client's appearance, dress, grooming and hygiene, facial expressions, and eye contact. The next step is motor activity, the client's physical activity. Does the client move very slowly with very few gestures, or is he restless, agitated, hyperactive? The third step in the assessment is speech. Is it rapid or slow, loud or soft, slurred, difficult to understand? Mood is the next step in the mental status exam. This is more of an interaction between you and the client as you assess his mood. Like, how are you feeling today? If you suspect the client might be suicidal, ask about those thoughts. Does he have a plan? Does he have the ability to carry out that plan? Affect represents the client's emotional state through facial expressions, hand and body movements, and pitch of voice when the client is expressing feelings. Now, perceptions. Is he having hallucinations? Hallucinations involve any of the 5 senses: hearing sounds or voices that others can't see, peculiar odors that others can't smell. There are 2 key questions here. Are you seeing or hearing things? Yes? What do they look like? Or what are the voices saying to you? Rather than a hallucination, it might be an illusion, a misinterpretation of environmental stimuli. Instead of seeing a curtain by an open window, the client sees a person standing there. That's when you look to the client's thought content. This is where you, as a nurse, really question the content of what the client is communicating and thinking. Do you worry about specific issues or have recurring, persistent thoughts? Do you feel like things are strange or unreal sometimes? Do others watch you? After thought content comes thought process. That's the how of client communication. Is his speech clear, logical, and organized? Next, assess orientation or level of consciousness. Some clients are offended by the routine questions of place, person, and time. You may have to get creative. Instead of, do you know what time it is? Try, how long have you been here? For person, you can ask, what kind of work do you do? Are you married? Do you have children? This leads us to recent and remote memory. For example, if a client reports that he was admitted to the hospital 2 days ago, check the hospital admission assessment. Or if the client mentions a history of high blood pressure, validate that remote memory with his medical history or the results of his physical examination. After spending some time with the client, you'll assess concentration. Can the client pay attention during the interview? Then intelligence. In assessing intelligence, there are several indicators to look for: completion of school, general knowledge, vocabulary, and literacy. Be sure to account for local dialect and acceptable grammar usage in the area you're practicing. Look for the ability to abstract with proverbs. What's the meaning of the proverb, when it rains, it pours? Judgment and insight. Judgment involves understanding facts and making decisions, such as a client with schizophrenia telling you he doesn't need medication. What's your assessment of his judgment? Insight is the client's understanding of the illness or problem. Sometimes a client blames someone else, like his spouse, or your client with bipolar disorder says she's only in the hospital for a physical checkup. What's your assessment of her insight? These are the components of a mental status exam. You may find that several of them are apparent immediately, while it may take observation and the correct questions to assess the rest. Remember, every interaction involves assessment of the client's mental status, even when the client is unable to communicate. When clients are admitted to the hospital, their rights should be carefully explained. To keep personal belongings, to make and receive phone calls, to accept and refuse treatment, to receive confidential treatment, to communicate with people outside the hospital. The rights of a mental health client vary from state to state, so it's important to be familiar with the rights that apply in the state where you practice. Particularly important is informed consent. Consent forms require the signatures of the client and a witness. Consent is necessary for community or hospital treatment, psychotropic medications because of the risk of side effects, and treatments such as electroconvulsive therapy or ECT. Consent for treatment must be obtained even if a client is confused or psychotic. Clients also have the right to individualized treatment and the right to refuse treatment and medications. A guardian may consent to medications when the client is incapable of rational decision-making. If a voluntary client refuses medications, you'll need to consider the criteria for forcing medications. Is she a danger to self or others? Do the medication effects have a reasonable chance of helping the client? And is the client competent enough to evaluate the necessity of treatment? The final right to consider is a client's right to the least restrictive treatment environment. This applies to community and hospital-based programs. The least restrictive setting is treatment in the community. Clients treated in a community setting may voluntarily choose services or be court-mandated to participate. Next, hospital services, again voluntary or court-mandated. Be sure you know the procedure for involuntary commitment in your state. More restrictive is the use of seclusion. As you know, seclusion includes observing a client in a specific treatment area. Before you choose a restrictive intervention such as restraints, first consider whether or not there is adequate rationale documented for the events that led to the need for restraints, plus any options that were considered or attempted. And always be sure there's ongoing evaluation of the client's behavior while in restraints. When a nurse assures a client that all information will be kept confidential, it encourages open and honest self-disclosure by the client. Consider the most favorable response to the following scenarios. In this scenario, the client nervously tells the nurse not to tell anyone what she just told her. The nurse reassures the client that the doctor and nurses that treat her work together as a team, so they will need to share important information that will make a difference in her treatment plan. In this scenario, the nurse answers a call from a lady asking if John Anderson is being treated at her facility. The nurse responds by saying it's federally mandated that she doesn't share information about the clients in her care. The lady insists that she really needs to talk with John Anderson and that she heard that he was there. The nurse politely, yet firmly responds by saying that she's sorry, but she's not able to acknowledge whether a client is there or not.
I thought we'd never get a break. We ended up having to put Mr. Anderson in restraints.
Remember, you never know who's listening in a public area, like this cafeteria, or the halls and elevators. It's not the place to discuss our clients. Here, a lady approaches the nurse and says she's John Anderson's sister. She asks the nurse if she could explain his treatment and the medications he has been prescribed. The nurse responds by saying that she'll first need to ask Mr. Anderson to sign a consent releasing his treatment information. Clients have the right to the least restrictive treatment environment. What are some of the specific reasons for hospitalization? For crisis stabilization, for prevention of harm to self or others, for treatment requiring safety monitoring by staff, for management of symptoms that result in confusion, disorganization, and the inability to care for oneself, for rapid evaluation that requires frequent observation by staff. There are options for inpatient hospitalization. There are crisis stabilization units or community support options that include partial hospitalization, community support groups, community